Hello all. So if sheltering weren't complicated enough, it's just gotten a lot more complicated. So I'm going to give you some tools for planning for sheltering during this season. So general assumptions, Virginia typically has weather events. So we have some warning that things are coming, typically, although as we know from train wrecks to chemical leaks that things can trigger sheltering very quickly. So if possible, as Jonathan has already mentioned, the plan is to use hotels for sheltering to minimize individual contact, or possibly dormitories, particularly in closed universities where nobody has moved in yet. However, if a threat is imminent, individuals will be directed to a congregate shelter. This is another link to the same document that Jonathan referenced. I think one thing we do have to keep in mind is with the switch to smaller shelters and the push to do smaller congregate shelters, that's going to make it difficult for us to cover each shelter in person, even more so than it has been in the past. So some thoughts about medical staffing for shelters. Again, all medical and nursing staff should be fit tested for an N95 respirator and have knowledge about the PPE used to do testing for SARS-CoV-2. All medical and nursing staff should be knowledgeable regarding the collection of PCR samples for SARS-CoV-2 and be checked off on both NP and OP swabs. And all medical and nursing staff should know how to complete the DCLS laboratory form and package specimens for transport to DCLS. In addition, you're going to need to be thinking about if you are asked to open smaller congregate shelters, where those would be and how you would provide triage for medical and how you would provide support with the limited number of staff that you have. So some things to think about adding to your to-go bags or have ready to put in them. Again, contactless thermometers, surgical masks and cloth face coverings for shelterees, COVID testing PPE. Again, naloxone, one of the things that we have seen with this pandemic is we have a rise again in the opiate-related overdoses. Masking tape and marking tape to mark off 6-foot distances in possible family pods within congregate shelters, an increase in disinfecting wipes and cleaning supplies, and the pre-positioned DCLS, PCR, SARS-CoV-2 test kits, frozen ice packs, which if you know something is coming, make sure you have sufficient numbers of ice packs frozen in your freezers so that you could ship these kits if needed, and lab slips and coolers. Also, have ready laminated signage about decreasing the spread of COVID-19 so that you can post those in shelters. Think about reconsider your normal shelter setup. You know, usually we have the cots row on row, all facing in the same direction. You know, try to think of switching that to a head-to-toe kind of cot setup so that even in a family pod, one person's head is on one side and then the other person's head is at the feet. So in other words, push them opposite to each other to try to minimize airflow. Consider the use of screens or hanging drapes. If possible, I know that a lot of our settings are in gymnasiums of public schools, and I can't imagine how you would hang a drape, but if there's a way to screen, I'm sure some of you saw the alternate care site setups, particularly New York City, where they strung a clothesline and then placed drapes over the clothesline to try to cordon off some of the areas between people. Be prepared for staffing shortages and fewer volunteers available to staff shelters. I'm already getting some information from folks that are out in California, some Association of Public Health Nursing colleagues, that they're having to look at congregate shelters, and that fewer volunteers, because they're elderly and may have pre-existing conditions themselves, are not willing to work in a congregate shelter. The other thing to consider is a no-touch waste can that you can operate with your foot and you can, have a cover on it, versus the large rolling open trash cans that we typically have in schools. again, to help minimize any splatter or spread. So triage for shelter and entry. So we were talking about testing in shelters and how or if we should test as people enter shelter settings. But based on guidelines from the CDC, broad shelter entry testing is not recommended. They've done some work in looking at homeless encampments to see if that provides any reduction for person-to-person spread. But they haven't shown that that's been effective. So all individuals entering the shelter will be screened for COVID-19 symptoms and exposure, but we will not test each person coming into the shelter. There is a triage screening document workflow within the body of the information that's contained in the document that both Jonathan and I have referenced, and I think there's about 17 different links in both of our presentations, so you should be able to find it. But if not, just give me a shout and I'll help you get there. So basically, you're going to ask the questions on the screen in front of you of each person as they enter the shelter. Really looking at, do you have symptoms? Do you have worsening cough? Do you known to be in contact with a person with COVID-19? All the symptoms that we're used to asking before people enter our health departments anyway. If they say no to all, you're going to provide a face mask. If a face mask, again, could be either a surgical mask or a cloth face covering. And messaging should be out to the whole world to bring your own. You can complete a standard medical screening intake form after you've done the COVID screen to determine placement in the general population shelter or in the designated medical needs area. Again, provide regular and ongoing assessments at least once a day of all clients that include temperature checks. Again, contactless thermometers are going to be your friend, and we're going to be checking them for COVID-19 symptoms. If they have any fever or symptoms develop, you would notify shelter management, direct them to a designated quarantine site. Again, you're going to have isolation areas and quarantine areas or other designated room. And then you would go to the algorithm that if they answered yes to any exposures or symptoms when they entered. Go ahead. So if when they entered, they answered yes, they'd been exposed to somebody who had COVID-19 or they were having symptoms currently, please provide them with a face mask, notify shelter management, direct them to an isolation area or other designated room for individuals known or suspected of being COVID-19 positive. After their arrival in the isolation room or area, complete the standard medical intake form to identify other chronic medical conditions that could put them at higher risk for COVID-19. If they have an exposure but no symptoms, then they're going to be in quarantine and continue to monitor and assess for fever or symptoms until quarantine period has ended. If they do have fever, determine if testing is warranted. If so, then they recommend doing a COVID-19 PCR test, continue to monitor the client and assess for any worsening symptoms. So I'm going to talk a little bit about the pre-position tests next. So you should have already received 25 COVID-19 test specimen collection kits that were sent out by DCLS. These were sent to all 35 health districts. These are supposed to be only for shelters and are intended and should be specifically taken to a designated emergency shelter or other emergency place. For the 2020 hurricane season, DCLS will be deploying these kits, and they should already be there, and they were deployed by August 26th. After hurricane season, the health district can keep and use these kits for other needs. If the components expire, discard them and return the expired components and return the remaining materials to DCLS for use. So basically, during this season, health districts should maintain a minimal on-hand supply of test specimen collection kits through the hurricane season. And this is the DCLS number to call if you need additional kits. And the health district director is responsible for making sure all relevant staff are aware and understand this guidance, as well as the availability of test specimen collection kits. Health districts should develop procedures to ensure test specimen collection kits are deployed and available to shelters. And that includes that they have staff that know how to collect them, how to use the PPE, and how to package them and label them for sending to DCLS. If you do collect specimens, if it's needed, the on-site staff need to don the appropriate PPE and follow all NP or OP collection directions. So you're going to need to coordinate the test request and courier pickup of samples with DCLS. It can be done directly from the shelter or from the Health District Operations Center if activated. So these are 3 numbers, and you will get these PowerPoints and the DCLS after hours emergency number to let people know that let DCLS know that test kits are coming from a shelter so that they can prioritize these tests. Complete the lab submission form that's included in the test specimen collection kit and package per guidance, and make sure that you maintain proper cold chain measures. That's why it's important to have pre-positioned, pre-frozen ice packs ready to go should you have to open a shelter. So it is going to be critically important to identify both isolation and quarantine areas in your designated shelters. Quarantine areas for folks that have been exposed but are asymptomatic, and isolation areas where people have been exposed or have known symptoms of COVID-19 or a known positive test but have had to evacuate. If possible, use rooms with separate hard walls and ventilation systems, and consider the need to open additional sites to accommodate individuals who require isolation and quarantine. If possible, it's best not to separate family groups, but these are extraordinary times and we may be taking extraordinary measures. So additional medical considerations: consider EMS backup for transport of critically ill persons to the hospital and to have supplemental oxygen on hand. We know that not every health department has oxygen in their health departments any longer. That was no longer on the required list. We're not suggesting that you bring in any at this point in time, but it is prudent to have EMS on hand. Again, you should avoid all aerosolizing procedures, including the use of nebulizers. Encourage the use of handheld inhalers and spacers. And there's a link for the Allergy and Asthma Network, which should provide you with some tools for using spacers and also helping to make what I call homemade spacers out of things as easy as a styrofoam cup. So stress and resilience. People are already stressed in this panic. I'm seeing it in people lashing out in my neighborhood grocery store and at gas pumps and during fender benders. So it's going to be even more stressful when we ask them to come to a congregate shelter to preserve life and limb, and it's going to increase stress loads even more. So plan now for behavioral health resources for shelters. It's critical now more than ever. And be aware of staff stress. You may be dealing with fewer volunteers that we've already burned out in our early stages of this pandemic. So, plan now for frequent staff check-ins and stress relief resources. So this is about the Virginia COPES program through DBHDS, and it's funded to offer disaster or behavioral health services to Virginians dealing with COVID-19. As behavioral health is cumulative, it's not appropriate to utilize this service for both evacuees in need of disaster behavioral health services and for shelter staff in need of coping assistance. With the shift towards congregate sheltering. This is the primary tool by which DBH will be offered this hurricane season. So disaster behavioral health is about helping people cope and meet immediate needs. Active listening, normalization of thoughts and feelings, and referral to community or health-related supports is included. Disaster behavioral health is not therapy. There is no clinical service offered and no true counseling takes place in this clinical sense. Their call takers all have had psychological first aid and stress first aid training specifically targeted for both COVID-19 and telephonic interactions and delivered by Dr. Richard Westphal and Dr. Patricia Watson. They have also completed all required SAMHSA trainings to function in this capacity and are ready and willing to help any Virginian experiencing crisis. So I would encourage you all to incorporate this into your shelter resources, particularly for behavioral health. So I've included some additional links that you might find helpful in making your disaster preparations. I have my fingers crossed that we won't need any of this information, but it is there and we're doing the best that we can to pull it together centrally for you at this time so that you have everything that you need in the event you do have to open a shelter.